Hello, I'm Traci Dufresne, the Manager of Hospitality and Workforce Development here at Rhode Island Hospitality. Today, we are going to do a webinar with Lydia Brown from the Rhode Island Department of Health regarding norovirus, all the ways to prevent it, what to do if it happens, and the systems you should have in place. Thank you for watching our webinar. This is very important to public health, and Lydia is going to walk us through the Rhode Island Department of Health presentation she put together. Lydia, off to you.
Thank you very much, Traci. Good morning, everyone. I'm glad to be here, or good afternoon, depending upon when you will be watching this. And as Traci said, I am from the Rhode Island Department of Health. I am the Compliance Evaluation Standardization Officer, and I am glad to be with all of you today. So, our agenda for today is based on what causes foodborne illness, vulnerable populations, the CFP data, which stands for the Center for Food Protection Data from the Rhode Island Department of Health, that we tabulated from January 21st to December 21st, norovirus facts, transmission, outbreak investigation, Rhode Island Department of Health resources, and cleanup procedures, our SNET study, what we learned, food establishment guidance, and the Rhode Island Department of Health COVID-19 info link. And I'll explain that as we go on. So the Center for Disease Control and Prevention estimates that 48 million people get sick, 128,000 are hospitalized, and 3,000 people die from foodborne disease each year in the United States. That's quite the number of folks dying from foodborne disease, especially with all the technology and information that we have today. So what are the top 5 risk factors that most often are responsible for foodborne illness outbreaks as it would relate to food industry? So improper hot and cold holding temperatures, improper cooking temperatures of food, dirty and or contaminated utensils and equipment, poor employee health and hygiene, food that is served or that is in the establishment from unsafe sources. So who are our most vulnerable populations? Our most vulnerable populations are people who are immunocompromised, persons, children, pregnant women, elderly. These are the folks that can develop severe complications from norovirus. So our office, we did a routine inspections. And this, what you're looking at are the tabulation for the critical and non-critical violations that we noted during our routine inspections. We conducted over 6,183 inspections, and we had a total of 6,541, actually 37% critical violations, 10,902, a total of 63% of non-critical violations, which gave us a total of 17,443. Now, I want to say the critical violations, though they may be less than the non-critical, these are the violations, first and foremost, that can actually cause and help to facilitate foodborne illness outbreaks. And when you combine those non-criticals with the criticals, you have what we would call the perfect storm. So as we look at what we found, the violations that we found in January through December doing these routine inspections, we found that 1 and 2, which are person in charge, the active managerial control, and the certified food safety manager as required, that they have almost the equal number of technical violations when there is no certified food safety manager and active managerial control. This is huge. This is paramount to not having problems created in the industry where someone can come into work ill and thereby cause either a cross-contamination or a situation that can create a foodborne illness transmission one way or another. So we looked at the cleanup procedures for vomiting and diarrhea. Though this number is 277, that is huge. When you think about that, we have had an uptick in norovirus, and we'll speak about that a little bit more as we go further on. It's important that these procedures are in place for when there is a vomitous and diarrheal spill. You don't want to have to look for something to clean up vomiting and diarrhea that you don't know what is contained in it. You don't know if the person had norovirus. You just don't know. You want to make sure that you have all of your procedures and all of your practices already in place. Hands cleaned and proper washing. Though that number is low, hands being cleaned is critical. Properly washing your hands is critical to being able to prevent the spread of any virus, particularly norovirus. The other thought here is that when you're not washing your hands in the manner in which you should, you wind up having particles that you can't see underneath your nails or in between your hands that again can be used to be transmitted to cooking utensils or transmitted to the food. And you want to make sure that we're washing our hands properly. No bare hand contact with ready to eat foods. Bare hand contact with ready to eat foods is another way that we can spread norovirus. And you'll see that as we go into our epi summary. Adequate hand washing things. Well, I mean, let's think about this. If we're talking about how critical it is to wash hands, it's important to have adequate hand washing sinks available and supplied, having soap, having paper towels. There were 1,032 violations that were associated with not having adequate hand washing sinks. And that is something that is concerning. We need to be aware that if you don't wash your hands, if the sinks aren't available, if the sinks are blocked, if the sinks aren't supplied with the proper soap, then hands are not going to be washed as they ought to. We also noted that raw food was being stored over ready to eat. So we had some blood dripping from beef onto ready to eat cheeses. We had eggs stored above cooked, ready to eat foods. These are the kind of things that we were seeing in approximately 421 of the violations. And not just those things, but other things that we were seeing as well. We had food contact surfaces that were cleaned as far as cleaning and sanitizing. There were 1,329 violations that were related to slicers that hadn't been cleaned and sanitized, in-use utensils that had not been properly cleaned and sanitized, such as cutting boards. And again, we think about the spread of norovirus and how this can happen. And it's because of these factors that we're pointing out here regarding the violations that we saw for January through December 2021 on a regular basis. That's pretty alarming, to be perfectly honest. We found that proper cold holding temperatures, units that were close to the grill, they don't tend to hold temperatures well. And as we're moving closer into the summertime, we'll see that if these units are not being maintained, if they're not in good repair, then they're not going to hold the proper cold holding temperatures. And that's going to create a problem because that in and of itself can help to facilitate norovirus. Norovirus can live at certain temperatures, as well as listeria. Listeria can live in cold temperatures. Proper date marking and disposition. Proper date marking was established specifically to prevent the growth of Listeria monocytogenes. Products with 7-day shelf life can grow in temperatures 40 degrees and below. And Listeria is one of the deadliest foodborne pathogens that affects pregnant women and their fetus. Unexpected termination of pregnancies can occur when foods are not held at the right temperature, when foods are not disposed of when they should be disposed of. So you can see where proper cold holding temperatures and proper date marking and disposition, they work together. All of these are critical violations, and they work together to help to prevent the spread of various pathogens, to eliminate the growth of various pathogens as well. So these practices are put in place so that we're able to protect public health and to keep everybody safe, as well as keep, industry working together and working, period. We've been in a very difficult and challenging times. And right now, we just want to make sure that everybody is safe, industry as well as the public that we're serving. We look at the toxic substances properly identified, stored, and used. There were, let me go back up to the consumer advisory. Raw and undercooked foods. We had 117 violations where there was not a consumer advisory. This is important for industry. This protects industry to have this advisory posted, so that if there is a product that you are cooking and it is going to be undercooked or served raw, that the public that you're serving to is aware of the fact that consuming this food can potentially lead to some type of illness. So you need to make it very clear on the advertisement, in the menu, on the board, somewhere this needs to be noted. But 117 places that we went to did not have this noted. Toxic substances properly identified, stored, and used, 345 violations. There is not a good practice to have bleach or some other substance that is taken out of a bulk container and put into a plastic bottle and stored on a countertop where anyone can access it and not, know what's in that bottle, and accidentally, in the mix of doing something, think that you're picking up a white vinegar, when in actuality, you're picking up an ammonia or you're picking up a bleach, and you're going to put it onto someone's food. These things have happened. This is why having things properly identified, stored, and used, toxic substances specifically, is so vital. Moving forward, want to look at, as I said, the noro-like outbreaks. We are in, or had been in, the norovirus season from November to April. It's from November to April. However, over the nation, we have been receiving reports of noro-like illnesses. There have been more and more people that have gotten ill from noro-like illnesses. The Center for Food Protection has responded to 8 noro-like outbreaks just in this year, and we're only in the middle of May. There are approximately 20 million cases annually in the United States of noro-like outbreaks. So some facts. A lot of people tend to think that norovirus is related to the flu, but it's not. The flu symptoms are usually respiratory, whereas noro is gastrointestinal. Children mainly exhibit the vomiting, whereas adults will usually have symptoms of diarrhea. But adults can also have diarrhea and vomiting, as noted in the picture at the very beginning of this slide of this presentation. So the symptoms include stomach pain, nausea, and vomiting, and diarrhea. As you can see, norovirus is highly contagious. It is highly infectious. At this picture right here is one of my favorite pictures of all time, because it magnifies and it shows how 18 viral particles of norovirus on your food or your hands can make you sick. And that's enough. Those viral particles are enough to make 1,000 people or more ill. They can infect 1,000 people or more. And this is just kind of sort of depicts how contagious, how infectious norovirus is, and it doesn't take a tremendous amount of it. If you look at this picture, it's really quite staggering. So norovirus is also resilient. It survives 140 degrees Fahrenheit for 30 minutes. It remains infectious, as stated before, on frozen foods. Asymptomatic individuals can be carriers. So you can look perfectly fine. You cannot have any symptoms and still be a carrier if you have been a care provider for someone or have been somewhere where someone else has been ill with norovirus. Infected persons shed before and after being ill with norovirus. It stays on countertops and serving utensils for up to 2 weeks if these areas are not properly cleaned and sanitized. How is norovirus spread from people or surfaces? Well, if you look at the slide here, you see that if you're providing care for someone who's ill, you might have a baby that has norovirus and has poop in their diaper. You might shake someone's hands who had been in contact with, or they themselves had norovirus and were not aware of it. You may touch a surface, and that surface could be contaminated from where the person who had norovirus and was not aware of it touched that surface, the door handle or what have you. And then we have the human proclivity that we have is to touch parts of our body, namely our mouth. So consequently, whatever was on our hands happens to become part of what goes into our mouth. You become ill with norovirus. As far as other sources of transmission, there are multiple ways you can become ill with norovirus. Ill food workers contaminate food directly or food surfaces that can infect people. Sometimes the food is already contaminated by the fecal matter that's in the water. And when you care, like the previous slide shows, when we're caring for or being around an ill individual, it can put you in direct contact with things like vomit, diarrhea, and contaminated surfaces. When we look at norovirus in food services, we look at, and these statistics, by the way, are part of a study that was conducted by SNET. And I will speak more on what that means when we get to the SNET study. But what I'd like for you to know is that this was a study that was worked out with the Center for Disease Control. So these numbers here, or these observations here, are on point with what was observed. So what was observed in food service workers was that 1 in 5 food service workers reported working while ill. Outbreaks caused by infected food workers. 54% involved food workers touching ready-to-eat foods with their bare hands. Again, that's going back to hamburger buns, toast, lettuce, tomatoes, cheese. None of those things have a kill step. So when you touch them with your bare hand, it might not seem like anything, but if you're an infected food worker, that can contaminate that food because it will not have a kill step. Food service workers were observed with proper hand washing only 1 out of 4 times that they should. So when somebody was watching a food service worker wash their hands and the food service worker wasn't aware that they were being watched or observed, I'd rather say, they were only washing their hands 1 out of 4 times that they should. So going from one task to another task, hands weren't being washed. Going from ready to eat or from raw to ready to eat, hands may not have been washed. So that's something that, again, we want to look at in terms of how we're practicing and conducting ourselves when we're handling food. Norovirus, as stated, is hard to kill. It stays on food, kitchen surfaces, and utensils. And norovirus resists many common disinfectants and sanitizers. So what are some of our preventative measures? Well, proper hand washing, especially after using the bathroom. prior to eating or preparing food or handling food, prior to giving someone medicine or taking medicine for yourself. Don't prepare food while you're ill. This applies to people who work in restaurants, daycares, long-term care facilities, schools, and anywhere else people can be exposed to norovirus. The Rhode Island Food Code, per the Rhode Island Food Code, individuals ill with norovirus need to be excluded from work until 48 hours after their symptoms resolve. So if you still have symptoms, you need to wait until 48 hours after the symptoms have resolved before you return to work. And proper handle of food and preparation of food. Wash fruits and vegetables thoroughly. It can prevent the spread of norovirus. Cook foods like shellfish thoroughly prior to consumption. Remember, norovirus is resistant to heat and can persist at temperatures up to 140, 145 degrees. This diagram right here just shows us, it's not that anyone doesn't know how to wash their hands, but clearly when we are in a situation such as working in the restaurant or working in a healthcare facility in the kitchen, we're working on volume. We're working on trying to get the breakfast out. We're working on trying to get the lunch out. And there are occasions where we can tend to cut corners. So we need to understand that in going back to looking at the violations and recognizing the fact that proper hand washing was one of the things, or a blocked hand washing sink was one of the things that was critical that we found in the violations from January through December 2021. So we want to make sure we wash our hands properly. We want to wash our hands, so that we've got enough soap and enough water on our hands, warm water. The slide says to cut off the water. You don't have to cut off the water in between washing your hands. That just is extra time that, none of us really have. But what we want to do is we want to make sure that we wash our hands in between our fingers. We want to wash behind our hands. We want to scrub our hands and make sure that under our nails are clean. And we just want to make sure that we are doing that for like 20 seconds. And if you find that you're having a problem with knowing what's 20 seconds, just start humming in your head, happy birthday to you, happy birthday to you, or happy birthday to me. Or, whatever works, or the ABC, A, B, C, D, E, F, G. I know I'm not a vocalist, but I figured I'd throw them in there for just a little bit of, giving you an idea. Then you want to rinse your hands well under running water, and you want to dry your hands properly. And you want to remember that there are ingredients that are found in antibacterial sanitizers that do not kill norovirus. Let me say that again, this way. Proper hand washing is critical. Ingredients found in antibacterial hand sanitizers does not kill norovirus. At this point, we have this 2-minute and 11-second video that I'd like for you to watch, and it's from the Center for Disease Control on how to properly clean up an incident where there may have been a norovirus vomit or diarrhea has occurred. That particular video, again, was provided by the Center for Disease Control. It's important, very important, to clean up a vomitous or a diarrheal spill effectively. We have here provided a norovirus cleanup kit that we work with industry to develop. And we did this because of a particular incident that we had approximately 3 or 4, maybe longer, 5 years ago, tops, where we were actually we were called to an establishment because of noro-like symptoms that were persisting among different people who had eaten at this particular establishment. And consequently, the place had a one-way into the dining area and a one-way out. So folks had to actually walk through the area where this particular vomitous spill was located. And because there were not the proper procedures and protocols in place, it wound up spreading to a whole host of people. This particular diagram here, again, provides you with the cleanup materials that are needed so you can cordon off the areas and you can protect the area, and so that there are not multiple people who are cleaning up this spill. It's important that folks have the training and people know who is going to be making sure to clean up the vomitous or diarrhea spill when it takes place. And also with that, to know again that every product that you would use that is considered to be a disinfectant is not going to be effective against norovirus. There's an EPA registered disinfectants that can be used to clean up norovirus that are effective agents to clean it up. Bleach, when you use bleach on different surfaces, whether it's a clean, hard, non-porous surface or soil hard, non-porous surfaces or soil porous surfaces, there's a specific amount of bleach that should be mixed with water to get anywhere from 1,000 to 5,000 ppm, parts per millimeter. And you want to make sure that the amount of time that this concentration of bleaching water solution is adequate for the proper cleaning up and sanitization and killing for norovirus. As you can see here, contact time on these surfaces, it should be 5 minutes, at least 5 minutes. Norovirus is resistant to many common disinfectants. The label should be read to confirm the disinfectant is effective against norovirus. It stays on countertops and serving utensils for up to 2 weeks if these areas have not been properly cleaned and sanitized. For clean protocols, the right concentration of bleach mixed with water have been proven to be most effective. Steam cleaning any cloth furniture such as a couch or chairs that maybe have cloth material and or rugs is effective against norovirus. And I know that I've been repeating some things over and over and over again, and I think that it's because we want to really bring home the fact that antibacterial soaps do not, or antibacterial solutions do not kill norovirus. Certain products do not kill norovirus. So it's important to make sure that we're using the procedures and the protocols that will be most effective in killing off norovirus and to keep it from spreading. So as we move on, I'd like to speak to you about what we do during a outbreak investigation. We use what is referred to as a 3-leg stool used in our investigations, our foodborne illness investigations, meaning we have a team of people. We do not operate within a vacuum. We couldn't get it all done. What we do, is we utilize the Center for Food Protection, and we provide the on-site investigations at restaurants and or other establishments like long-term care hospitals, long-term care facilities, and hospitals. And we enforce the food code. We work with the Center for Acute Infectious Disease and Epidemiology. The short of the name is CAID, and CAID is in charge of surveillance. They do a lot of our interviewing. They do the outbreak statistics. And then we work with our state health laboratory. And they are in charge of processing the samples that we submit to them, analyzing and reporting the results.
It's important for people to know that an outbreak is 2 or more individuals because, you know, sometimes people will eat stuff and it just doesn't agree with them and they automatically think that they have a foodborne illness, right? Because they just don't know. So it's definitely important for the 2 or more individuals and to be recognized that they're from separate households, because as you stated, it's very catchy. So if I live with somebody, they're probably going to get it, right?
That's very true. That's very true, Traci. And the other thing is, excuse me, is that there are similar illnesses and a common exposure. So that's what an outbreak definition is. The Rhode Island Department of Health, Center for Food Protection, we received an illness complaint, and it's on 6/9/2021. I'm so sorry.
You're fine.
The report claimed that 8 out of 8 persons who had eaten at establishment A on 6/5/2021 became ill over the next few days. At the end of the day, on 6/9, Center for Food Protection received a second illness complaint regarding the same restaurant. These complaints were shared with the Center for Acute Infectious Disease Epidemiology. So what did we do? Well, in our outbreak investigation, on June 9th, we sent out an investigator, a person who is one of our specialists, to do an on-site investigation. And we learned that 6 employees were ill, called out sick, and the facility had received 4 illness complaints from patrons of being ill. Employees were observed eating and drinking out of open beverage containers in the food prep area. Excuse me. 2 employees reported working while ill. A good thing here was no beer hand contact was observed while we were in the establishment. However, as I stated, employees were observed eating and drinking, or drinking in the food prep area. And based on the food code, section 2-40111B, a food employee may drink from a closed beverage container if the container is handled to prevent contamination of the employee's hands, the container, exposed food, clean equipment, utensils and linens, and unwrapped single-service and single-use articles. While we were on site, what we did was we provided guidance on cleaning and sanitizing for norovirus. We also had the nurses from CAID. They did all of our interview with all ill employees and ill patrons at the establishment. The establishment voluntarily closed on 6/10, and we actually had planned to allow them to open before then. Well, the establishment closed on 6/10 for 4 days. And we planned to allow them to open before then if they had enough employees cleared to work. Many of the patrons that were interviewed by CAID reported eating the lobster salad. We had, sorry about that. We had a syndromic surveillance in Newport saw an uptick in GI cases during this time. On June 10th, the establishment, as I said, voluntarily closed for those 4 days due to the Rhode Island Department of Health requiring each employee to submit a stool sample prior to returning to work. On June 12th, the establishment reopened for dinner. 6 employees tested positive for norovirus. Those who didn't get tested were allowed to work again on June 14th. So, as we did our follow through here, to understand what we're looking at, we looked at a primary case, and the definition of a primary case in this outbreak is an individual who experienced vomiting or diarrhea between May 26th and June 9th, and who worked or dined at establishment A. 22 primary cases, 15 of which were patrons, 7 food workers, and 1 secondary case. Further exclusions were necessary because there were workers that, as mentioned earlier, that had worked at a different establishment. And so those workers needed to be excluded not only from the establishment A, but also from any other establishment that they had worked at until 48 hours after when they were symptom-free, after they were symptom-free. And CFP provided hand washing and cleaning guidance to all food licensed establishments in Rhode Island. So the conclusion, what we learned. We learned that the vehicle of the food outbreak was determined to be the lobster salad. 14 out of the 15 patrons, 93.5%, reported eating the lobster salad. Makes you want to rush right out and have lobster salad, right? It's still good. There's no reason not to have lobster salad. Okay, we've got this under control. The pathogen was confirmed to be norovirus through stool testing facilitated by RIDOH's State Health Laboratory. The contributing factor for the outbreak was determined to be C11, which is a code on the epiform that points to glove hand contact by a food worker, handler, preparer who is suspected to have been infectious with norovirus. The Rhode Island Department of Health provided resources and has these resources available for industry on our food safety resource library and can be accessed at any point or time. So please feel free to go to that website at the bottom of this page and get any of those resources, the guidelines for vomiting, responding to vomiting and diarrhea, the list of EPA chemicals effective for norovirus, and access to the cleanup kit as well as other documents also. I had mentioned earlier about the SNET study. And so the Center for Food Protection has a grant to, or actually had a grant to work, well, we still have the grant, I shouldn't say that, has a grant to work collaboratively with CDC to do foodborne illness risk factor studies as it relates to food workers' knowledge, attitude, and behavior. And from that study, we found out that infected workers cause 70% of norovirus. 1 in 5 food service workers reported working while sick with vomiting and diarrhea. 12% of food workers reported working 2 or more shifts while experiencing vomiting and diarrhea. And 10% of managers reported working with symptoms. So the question was, why are people working while they're ill? And what can we do to help to remedy this situation? How can industry work together with the departments of health to make sure that we are protecting public health? What can we do? How can we work things out so that ill food workers are not working? Of outbreaks caused by infected food workers, 54% involve food workers touching ready-to-eat foods with their bare hands. Food service workers, again, were observed, proper hand washing only 1 of 4 times that they should. So, what we learned is that ill food workers work because of the fear of job loss. They have a commitment to their colleagues. They're concerned about leaving their colleagues short-staffed, concerned about finding a replacement. They have a genuine dedication to their job, and they have no paid sick leave. A lot of places, there is no paid sick leave. Part-time workers don't always have enough time, paid sick leave time, and full-time employees must have enough hours accumulated before they are paid for taking sick time. These were all significant factors. So what were the recommendations that came out of this? Create clear ill worker policies that require reporting to managers. Cannot say it enough, cannot emphasize it enough. Training. We can't think that people know what they're supposed to do. And it's important, even if we cross-train, to have someone who we've trained to do some train the trainer, train others. And there's such a high volume of turnover that we need to go back and do retraining. Again, we have all been struggling because of the pandemic. And so industry is fighting hard to have the proper persons in place to do the work. And sometimes you'll get somebody and they don't stay. If they don't stay and someone else new comes on board, then you have to train that person and make sure that that training is ongoing. That seems to be my bandwagon, the training. I think the training is just so vital. It's just paramount in preventing the spread of foodborne illnesses. Have an on-call workers policy or procedure in place, and allow workers to make up lost time, lost hours. These are resources that are available to you for any information that you want to know about any of the recalls from FDA or from USDA, CDC, foodborne outbreaks, recalls impacting Rhode Island. These links here can all take you to places where you can get further information. Finally, we've had an uptick, and I know everybody, including myself, we're just like so done with COVID. However, the reason why this slide is here is because some of the very same procedures that we use to clean up or to address COVID in terms of making sure to keep it from spreading from one person to another, such as washing our hands, are similar to norovirus. So, excuse me, with the fact that there are constantly changes with COVID, and also because we want to make sure that we're washing our hands, whether it's COVID or whether it's norovirus. We want to make sure that we're following the proper procedures and protocols that will help us help you and protect public health. We provided this slide so that you can go to this website and get any information that you may need or desire that can answer your questions.
All right. Well, first of all, thank you. That was so much information. It looks like the Rhode Island Department of Health has been very busy, but it looks like the restaurant industry and food service business has some work to do. So I'm very stuck on the 18 particles of norovirus can get you sick. That's crazy to me, right? I think it's interesting how you were spot on when you said norovirus and COVID. They don't mirror each other, but they're similar. And we definitely need to be in the know. And those inspections that you conducted, some of those results are they're eye-opening, they're scary, and wow, we have some work to do, right? So I just wanted to take a couple of minutes and ask you a few questions that have come up from the industry during my ServSafe instructor training. Just things that people have asked, and while I think I know the answer, you're the actual expert. So when we talk about bodily fluid kits, do you suggest having more than one, having a couple?
Actually, if you have one in place, that's fine. And the important thing is to have it, but also know how to use it, and to have it designated to who is going to do what. That's real key. Yeah. So one kit is sufficient. Okay. If it's a huge establishment, would you want more than one? Of course. But if it's
one is enough.
One is sufficient.
All right. So I know you had used an example about someone got sick in a restaurant. Since norovirus is so catchy, if that tends to happen and it's not controllable, would you suggest maybe closing the operation for the day just to kind of eliminate further exposure?
It depends on, again, let me go back to saying it depends on, first of all, we will be notified. Right. And so someone will come in and do an investigation. And if it was not contained, and if there was the potential, such as the establishment I mentioned, the one way in, the one way out, then it would be possibly recommended to do a voluntary closure. A voluntary closure is not always necessary, but again, it depends on whether or not you have protocols and procedures in place that you have followed and people are trained.
Yeah.
Does that answer your question?
That does answer my question. I was pretty sure that's what you were going to say, but I have been asked that quite a few times. So, then I was also, we talked a lot about hand washing. Something every single time I teach about hand washing, something that catches me off guard, because I was always taught no fake fingernails in the back of the house because it gets under your nails, and and it could be a physical contaminant, which is a whole different situation. But that still is a guidance, right? No acrylic nails in the back of the house for safety, right?
So yes, and that actually is in the food code under that same, in that same area that I spoke about regarding not, personal hygiene. It's in that same area of the food code. Excuse me. And it's important. What you said, Traci, is so true. You can have particles of poop. And this is something that, I say this because it's so true. No matter how good the toilet paper is, there's always going to be breakthrough. So if you're not washing your hands properly, if you have, fake nails on, or the acrylic nails on, excuse me for the word fake, the acrylic nails on, you can't always get under them the way you would want to. So the likelihood of there being particles of poop underneath of those nails and being able to be spread to someone if it's infected with norovirus or anything else for that matter, there's a high likelihood, a high probability. We try to make sure that people are washing their hands thoroughly and using gloves. However, the food code does speak about certain practices that are not the best practices. And what we're trying to enforce here and elicit are using best practices.
Yeah, the glove thing, it is a situation. It comes up a lot. I find especially with garnishes, let's say like the salt and pepper finish, parsley finish situation, I would always suggest, just like you said, best practice, just wear gloves. It's just better, protects everybody, right? Yes. They're not that expensive.
And don't think that gloves, just because you have gloves on, not that anybody is thinking this, Don't think that you can wash the gloves. No, take the gloves off, wash your hands, don't new gloves. That would be the thing to do. That's the ideal thing to do, you know?
In a perfect world, right?
In a perfect world.
I just have one more question. So if my employee calls me and says they think they have a foodborne illness outbreak, my first call is to the Rhode Island Department of Health, correct?
Actually, your first call is not to the Rhode Island Department of Health, because you want to first find out what the symptoms are.
Okay.
That's what you want to do. So you want to ask your employee a series of questions, what the symptoms are, when did they work? And then you want to be able to call the Rhode Island Department of Health to provide them with as much information as you can. So yes, you are going to get in contact with the Department of Health. That's a very good thing. Absolutely. However, you want to be in a position of what I would call strength, you know, proactive. We asked around how many persons you were in contact with. We asked what your symptoms were, and then you want to be able to call the Rhode Island Department of Health and call from a place of strength. Call from a place, we are working together. That's the whole idea.
That is the entire idea. Like, just because you're getting a health inspection, it is not a bad thing, right?
No, it is not.
We are working together. We have a obligation to the public. We're serving the public. That is our job. I can make my own decisions at home with what I want to do with my food.
That's right.
I cannot make that decision for the general public. That is not my job, right?
That's an exclamation point goes right there. Very good. Absolutely. Absolutely.
Good. Well, thank you very much, Lydia. And as Lydia stated, guys, the Rhode Island Department of Health website is very user-friendly. You can download various things, allergy posters, all kinds of food safety information for your staff, because as Lydia said, the training is never done, right? So if you need anything from the Rhode Island Department of Health, please visit their website. You know where to find me if you need to email me or ask any questions. And I hope this was a helpful training. I know I learned a lot of stuff, and I teach this all the time, and I've been there, so I'm sure all of you learned. Lydia is a wealth of knowledge in this area, and I'm sure many others. So thank you, Lydia, and we appreciate it.
Just want to say the Rhode Island Department of Health is here to help, and to reiterate what Traci said, that we are a team of people, and just because you have an inspection does not mean that it is an adversarial thing. It means that we are here to work together and be of help in whatever way we can. Teamwork makes the dream work. Thank you all so much. Thank you, Traci. It's been wonderful. Appreciate it.
You're welcome. Bye-bye.